Good morning, everybody. Today is the 13th of January, 2024. Um, Today, we are going to be talking about a new case and a further exemplification, a further elaboration of the cycles and segments that I talked about in my last video. Okay, so today we are going to be talking about a new unique case. But before that, let me just have a brief continuation about what about the case that was discussed in the last video. So the last case which was discussed was a case of cadmium sulfuricum, and this was about a 73, 74-year-old lady, and this lady with vertigo. So I didn't tell basically what was the result of the remedy. So I'm just going to briefly share that. The lady, after I administered cadmium sulfuricum in 1M potency, I just made her lie down for about 40-45 minutes. At the end of it, she reported that the vertigo was better by almost 80 to 90%. Okay. So I followed her up in the coming days and weeks, and she recovered perfectly. The gastric disturbance went away, the vertigo went away, and she didn't have any trouble after that. For total relief, it took about a day. The following day, she was almost 100% all right. So I wanted to stress the importance of giving the correct remedy. And in many cases, when you have the correct deep acting similimum, a single dose is sufficient in many cases. There are cases wherein even though it is the similimum, you will need to repeat. So there are different things. So today we are going to start with this new case. Okay, this is it's a beautiful case, and I promise you that you'll be learning something beautiful with this remedy, with this particular case, and and you will probably develop a deeper understanding about what keynotes are, okay, and how are they different from normal characteristic symptoms. A bit of the difference I've explained in my last video, but in this video, we are going to really go down to the wire and help you understand certain deep aspects of keynotes. Okay, so with that in mind, let's start, and I share my screen here. So this is a case which is called I call it the case of two poles. Now, this lady was aged around 35 years. She came to my clinic the other day. She complained of excruciating pain in the right shoulder joint. Excruciating pain. And she said this pain had developed over the course of the last day. Now, I asked her to enumerate her complaint and describe it. So this is what she said. She said the right shoulder had been paining since the previous day. It had started in the day and had been manageable till evening, the previous day evening. She went out to buy something in the evening, and that was around 7. She got exposed to a draft of air, and at that point of time, the pain aggravated to the extent that she could not even raise her hands. Now, she tried to sleep during that night. Her husband had given some hot compresses, but it did not help completely. It helped her a little bit, but she was forced to remove the hot compresses because she was feeling uncomfortable during the night, sleeping with the hot compresses. She said her sleep was disturbed that night and she could not get a proper sleep. The following day, she said that she was exposed when the sun came out. She felt a little better. Now, when I get these kind of sensitivity to draft of air, this sensitivity to the weather, the sun exposure making her better, I always make it a point to find out about a little bit more about her general constitution. Okay, so what I found out were these. She's a very, very chilly patient. She tells me that her extremities become very cold and she has to wear socks and gloves during the night. She says she cannot tolerate a draft of air. Now, this is what is the case that we have. Now, of course, there are certain things. Looks like, we start with, making up the segments, each segment. We start up with making her segments. What do I mean by making her segments? I mean that her her basically chief symptoms. We compartmentalize all of her symptoms into 4 or 5 distinct varieties, maybe more. Uh, we compartmentalize it and put all the related rubrics into each separate compartment or segment. So now we can distinctly identify, even in this small short case, we can identify almost 4 to 5 separate segments. What are those? The first one is the frozen shoulder, the cramping. This is what eventually becomes the frozen shoulder. And I'm just uh, calling this segment the frozen shoulder. It starts with the cramping in the right shoulder. Now, what brought on the cramping? How did it start? There must be some modalities, and the modalities in homeopathy, as we know, they are very, very important. The first segment is the purely the sensation segment. You've probably heard of location, sensation, modalities, and concomitants of Bonninghausen. I call this segment, and I put all these, the related rubrics pertaining to one main characteristic of the case in one segment or compartment. So frozen shoulder in one compartment. I don't have any other sensation. It's a cramping in the right shoulder. That's it. Now I'm going to put all rubrics related to this frozen shoulder in that one compartment. Second thing, what brings on the cramping? It's an exposure to a draft of air. What other things brings on the cramping? It's exposure to evening and night. And it's also, with this you can understand, because it is very cold here towards the night in Bangalore where I practice, that cold also brings on the cramping. What aggravates the cramping? Now here, I wanted to inquire a little bit more on what aggravates the cramping. We already know that exposure to draft of air and cold and night brought on the cramping. But what else was the case? Little bit more digging into her case, asking her to tell us symptoms. She told me that it was not so much the fact that during the night she could not keep the pack on, the hot pack. It was just that it was becoming uncomfortable after a short time of keeping the pack on. She would get relief for a while, then she would feel like removing the hot pack or hot compress. This is very, very interesting in the case. We have to focus on this. Why she became better for a short while after putting the hot compress, and then she was not so better and she wanted to remove it because she was feeling uncomfortable. I asked her a little bit about, you know, uh, what she did in the night. Like, generally, does she puts the covers on while going to bed, or she lets the covers off? She said she would put on the cover for a while because she's very chilly patient. And then after a while, she would feel uncomfortable and remove the covers. So what do you see? You see a distinct polarity. She's shifting from feeling very cold, and to this she remedies it by a hot compress, or maybe covering her up with a bed sheet or some razai or a blanket. Then she feels uncomfortable with them, and then she decides to remove it. So these are two poles. It is not consistent. And so I make it a separate segment. The warmth as well as cold aggravates. So I keep the cold aggravation in one segment, the warmth aggravation also in another segment. Now, the funny thing also is that the warmth actually makes it better also. In the night, even though she will feel better with the warmth, by putting on the covers and by wearing a blanket. Also, in the morning, when the sun comes up, she'll feel better. The hot compresses also ameliorate her to some extent for some time. But again, if you look at it, she cannot tolerate either the hot compresses or the covers that she's putting. So that again, the polarity is there. But what I do is, well, making the segments, I keep these separate. I say, the cramping, the cold aggravates her, but the warmth also ameliorates her. She is better, even though for a short time. So what makes it the next segment, which is basically the what makes it better segment, I put that she's better by exposure to sun and better by hot compresses. Keep in mind that even though she's better for a short time, she's still better. So that becomes a separate segment. So the important thing here is she's actually better with warmth as well as she's worse from warmth. Both the modalities are present. There's a polarity here. And as much as possible, we'll try to encapsulate all these in the separate segments. Now, finally, what this is a case, when you look at it, it doesn't seem like an acute case because she's a very, very chilly person. She says that she has extremities which are almost like freezing. So when you are looking at something which is, like that, it is not surprising that a very chilly person cannot tolerate a draft of air, and her complaints have come on because of that. So what she requires is a deep constitutional remedy. It's an exacerbation. What has happened to her is an exacerbation of an existing chronic problem, which is the inability of the blood to flow to the extremities, which is the inability of her body to keep in the vital warmth. This, what we are noticing, this shoulder pain, this kind of acute frozen shoulder and excruciating pain in the right shoulder joint is an acute exacerbation of an existing chronic problem. Okay, so now I want to show you the 5 segments that I have put the whole case into. You know what I call this? This is a cycle. This is a cycle. And now what am I putting it here? I am putting extremities, the main sensation here. Okay, what brings it on? And it is caused or aggravated by cold and night. That is in one segment. She's also aggravated with warmth. That is also in another segment. What gives it better is another segment. You see, I have 2 separate segments here. One, she's better by she's aggravated by warmth, and she's ameliorated by warmth. Both are in 2 separate, distinct segments, as you can notice. Now, I also have a separate segment representing her constitution, which is basically the lack of vital warmth. I have kept it, all these rubrics, I am going to fill in to these individual compartments, and I'm going to compartmentalize all the rubrics that I find for in this case. So now, as you can see, extremities, shoulders, complaints of right extremities, cramp, shoulders, general pain, joints, cramping, extremities, cramp, upper limbs. All of these rubrics, they represent the same sensation, cramping, pain in the right shoulder. Okay. And as I said, this is a Boolean OR operation. Even if the same remedy comes in these multiple rubrics, it is going to be counted only once. For details, refer my previous video. This is basically through a Boolean OR operation that happens in the cycles and segments module, the Herscu module of radar Opus. Now you see what makes it better. The warmth makes it better. The best rubric I found, I did not find warm compress. I found warm stove ameliorates, warm becoming ameliorates. So I took both. You can take multiple rubrics. You have to cover, to make sure that the remedy that covers this case is present. Okay. Now there's a question of what aggravates it. It is caused by or aggravated by cold and night. Now I'm taking air draft cold aggravates. Coldness night aggravates. Cold becoming part of body aggravates. So all these I have taken. Her causation. What is the basic constitution? I have taken it here. Okay. Lack of vital heat, feeling external icy cold, lack of vital heat covered but aversion to being the peculiarities of the case. The lack of vital heat, warmth aggravates. This is very, very peculiar. You see, she's having a lot of chilliness. She basically puts on a hot compress or she puts on the covers, but can only do for a long time, for a very short time, maybe 10-15 minutes. Then she has to put away the covers and even she has to remove the hot compress because they also aggravate her. You see, which is which is what we want. You see, that is why I have taken the warmth ameliorate and the warmth aggravate both in two separate segments. Both of them are there. Both the poles are there in this case. And the complaint, the causation is a separate segment. What aggravates or caused the whole complaint in the first place. So now, when we did this, when we do the Herscu analysis, briefly, I'm going to stop sharing this, okay? And I'm going to share the screen on the Herscu module, okay? So you see, what did I do when I looked at it? Basically, I'm going to repertorize this case, right? See here. I'm going to take all clipboards. All these are there. You know, if you look at it, Herscu fundamental segments, this is exactly what I did, right? Now, all these things are present. Now I'm going to say, I'm going to do a Herscu analysis, which is going to give me all the pertinent remedies that are called into question for this particular case. Yes, this describes my patient. And you see, I am finding 10 remedies in 5 fundamental segments. And as you can see, because as we had already predicted, this is a constitutional case, you don't see any small remedies coming in this particular case. Populus indicus comes, but it is only present in 4 fundamental segments. We have about 10 remedies that are coming up for this particular case. And now we have to slowly identify what is the most appropriate remedy for this particular case. So stopping the share, going back to my original presentation. Okay. So you already saw this. Now, what can we see? The analysis of the results of the case. You know, I'm repeating here. What we can see is we can understand from perusing the case that this situation has occurred in the patient due to constitutional weakness. This is very important to understand. The last case that I discussed was from a small, medium, or a small remedy. And I have given you the reasons why we took the small remedy here. But here in this case, if you look at it, it's a constitutional problem here. I have treated this lady before, okay? And I had not been able to find a constitutional medicine, you know, but constitutionally, when I looked at the case again, when she developed this acute complaint, it was very, very clear that the physical generals were the same. I knew that she was a very chilly patient. The mental generals were the same. She's a little bit irritable, lonely person. There is that certain characteristics that she has. Keynotes, I was not able to identify in her case before, but now we will be able to look at her keynotes in more detail. But none of the physical generals, mental generals, or her predominant symptoms, constitutional symptoms, had changed. So this is a case of identifying the constitutional remedy of the case. You see? Now, the case has prominent physical generals and modalities. The acute crisis can be thought of as an extension of a chronic problem. Now, further, as the chief complaint relates to the whole person, we would either be looking for a polycrest or a medium remedy, and definitely not towards a small remedy. Now, we already have the main remedies for consideration. We can rule them out very quickly, one by one. Aconite, there was no fear or shock element, so that is ruled out. Aurum personality, this lady definitely doesn't have an aurum personality. The lady is a very mild, gentle patient. who is having a lot of problems of self-confidence. She's a timid person, definitely not a aurum personality who has high ideals, great self-confidence, self-discipline. No. Lady in question is also not a bryonia kind of person, also because bryonia is a hot patient. Naxwamika, even though Naxwamika can be chilly, lady Naxwamika is not timid, and Naxwamika is a very ambitious person. Okay. And we are looking at a constitutional remedy. We are not looking at Naxwamika as an acute. You can give Naxwamika even in acute cases, even though the constitution doesn't match. There's a stomach derangement, you can give it. But we are looking at for the constitutional remedy here. And that is very, very important to understand. We are looking at the constitutional remedy. So that is important to understand. Okay. Now, when we look at again the phosphorus, okay, if you look at the phosphorus again does not suit the temperament of the lady. Phosphorus is an extroverted person, you know. The lady in question is introverted. Phosphorus people constitutions are not shy. The lady in question was extremely shy. So these remedies are ruled out. And now we come to the remedies in question. What are the remedies that are left for consideration? We see carbovage, dulcamara, natramur, silicea, and camphor. So the first pass with the potential differential field, we removed 5 remedies. In the second pass, we can eliminate carbovage because we are looking at the cold chilly remedy. Carbovage is a definite hot patient and needs fanning. The lady does not need fanning. Dulcamera is an important remedy. You know, it is often used for this kind of frozen kind of shoulders and kind of problems, especially coming on with a draft of wind, a cold that comes on after a draft, after exposure to a cold or a chilly or a rainy or wet kind of weather. But Dulcamera doesn't have the constitutional depth in this case. Any remedy can be given any time, but if you look at it, Dulcamara lacked the constitutional depth to handle this crisis. That is, that was my first impression. It's a good remedy, so we'll keep it for consideration later on for the next pass. Natramur, natramcar are not so chilly that natramur is a hot patient. Natramcar is not as chilly as as this lady. Only sorinum, silicea, or camphor can be so chilly. Silicea has a degree of chilliness that our patient has, and we'll keep it as a valuable remedy for consideration. Camphor is an extremely chilly patient and has the keynote that this patient has of icy cold extremities. So we will retain that. So we are left with 3 remedies for our case: Dulcamera, Silicea, Camphora. Now, because we are going to make this prescription on a constitutional basis, I have to look at her state of mind, probing it more, her physical generals, and to a certain extent, her mental generals. Okay. So what are the mental generals? After a little probing, I find that generally she's a lonely person. Okay. She doesn't want to interact too much with the outside world. She gets confused with the outside world, and she feels happy reading in her own little world, reading about, some, what she says in Kannada Kadambari, some novels or certain stories which she likes very much, but which take her to her own imaginary world. So this is a peculiar symptom of camphor. Was among the 3 remedies, only camphor has this. Sleep, she said she gets very deep comatose sleep. Okay, almost like comatose. Generally, she's not sleeplessness, but she says the moment she takes some coffee or caffeine or some kind of caffeine in the evenings, her sleep is disturbed. When I put this rubric, aggravated caffeine, one of the prominent remedies that come up is camphor. So camphor is covered there. Silicea doesn't come, Dulcamera doesn't come. Thirst, whereas again, when I asked her about thirst, she says that, sir, I am not thirsty usually. Usually I'm very thirstless, but I do have a lot of thirst for icy cold drinks, and you give me as much, I can keep on drinking gallons of it. But recently I stopped drinking those kind of cold drinks because it hurts my teeth. My teeth have become sensitive, and so my husband also discourages me from taking it because he's very, very conscious about what food we take. So cold drinks are, have become minimal now. So now if you look at all these three, camphora is the only remedy. And finally, I want to talk about the principal keynote of camphor, which I was so confident on this case, and which the cycles and segments or the Herscu module naturally led to when I was looking at this case. The only remedy which is aggravated by both heat and cold, the only remedy which has it is camphora. This is the grand keynote of camphor, of the two polarities. It's an example of the grand keynote of camphor, which is the two polarity, the double pole, or having two poles. I'm pretty sure many of you are not aware of this, which is why this video will be a big takeaway for all of you people. Camphora has internal heat, external chilliness. This is the way it is described in the Materia Medica. So now let us look at a brief understanding of camphor. Again, to begin with, I delve into volume 7 of Vitolcus Materia Medica Viva. I have a great respect for Dr. Vitolcus. His Materia Medica Viva is one of the best books ever written. It costs about 25,000 to 30,000 rupees in Indian terms, but is worth its weight in gold because he has described many of the remedies very, very deeply. So for that, we are very grateful to you, sir. So let's going by that. Let us look at camphor. He says camphora is so powerful that it antidotes most of our remedies. He says that it should not be stored where homeopathic remedies are stocked or kept at home during homeopathic treatment. He says that this disruptive quality is not accidental, as camphora so deeply affects the vital processes of the body. Now he says the camphora prevents the blood from reaching the periphery. Now, before I get into the second paragraph, I think what he means is that if you keep camphor in a place, I don't think he means, the potentized camphor. What he means is actual camphor, which has a certain quality of getting sublimed in the air and getting mixed up in the air. You can inhale it. He says that that can cause some alteration in the remedy that you have already been taking. So yes, it's a good idea not to allow camphor to spoil your remedies, or anything that you have been, any remedies that you, homeopathic remedies especially, that you may have taken. So keep camphor away, also from any homeopathic remedies that you have been taking or you are taking. Now, the next thing we look is that the camphora prevents the blood from reaching the periphery, the head, the extremities, or the penis. It will cause collapse due to the shortage of blood to the brain. Raynaud's phenomena, ischemia of hands and feet due to the blood being prevented from reaching the periphery by spasms of the vessels, or impotence in the form of coitus that proceeds normally for a while, but the erection is suddenly lost. So you can see here that camphora has the main keynote that blood doesn't reach the periphery part of the body. Now, the keynote of the remedy, Vitolcus summarizes extreme cold, collapse, and convulsions, especially tonic convulsions. It is due to this very quality that camphor will act promptly in well-known conditions of fainting or collapse. What do you mean by tonic convulsions? Tonic convulsions are those wherein there is a strong contraction of the muscle, but the relaxation happens very, very briefly for that contraction. And then again a strong contraction happens, then the relaxation is very, very brief. to the point that you reach a stage wherein it appears that there is only contractions happening and the relaxation is happening for a very, very, very fraction of a time. This is tonic contractions, tonic convulsions. This kind of contraction, if you look at it, the body can become very rigid during such a contraction because there is no relaxation, you see. So for this, camphor is a very good remedy, even a very good remedy for epilepsy with these kind of conditions. Now, what he says, the appearance of a camphor case will be that of a person who is cold on the external surface of his body, face and nose. The face is pale and pinched or collapsed and maybe bluish or cyanotic. The tongue is cold, as is the mouth, and the breath is so cold that it seems to be coming from a cellar. In spite of this coldness, there's a desire for icy cold water, and the thirst can be so tremendous as to be virtually unquenchable. The peculiar symptom that indicates this remedy is a state of sudden collapse where the body is icy cold and yet the patient is averse to being covered. Now, there is a state of internal burning heat. So now what he says is that the circulation seems to have gone haywire. It is as if the natural contraction and relaxation of the arteries during temperature changes cannot take place. So he further says that we can imagine that camphor allows the arterioles suddenly to relax, allowing a surplus of blood to reach the periphery, and then they suddenly contract and almost totally cut off the blood supply, causing collapse and coldness. So you see, there are these two poles. Camphor causes this sudden surplus of blood. That is one pole of the remedy, pathological pole. Then it suddenly contracts and cuts off the blood supply. And so, if you look at it, Hahnemann in his Materia Medica Pura says that the action of camphor, he has not been able to differentiate the primary and secondary action of camphor because sometimes the same primary action appears as a secondary action and they are jumbled up. The reason for that is basically the presence of two poles in the remedy. The opposite is true when sometimes you would think that this is the actual state of camphor. So both of them are present. So it is sometimes the primary action and it is the reaction of the body, and sometimes it is the opposite symptom becomes the primary action and the reaction of the body becomes the secondary response. So they get jumbled up as for more you please refer the Materia Medicum Pura by Samuel Hahnemann. Now this is what Vitulka says is that the camphor state is one of opposites and not only in the field of heat regulation. He says an analogous situation also takes place on the emotional plane with the least provocation, with the least inflammation or pain. There is extreme excitability, then irritability, which soon goes into a kind of frenzy. This is one pole. The patients cannot control themselves and they do not know what they want. Patients can show frenzy, extreme irritability, or even violent behavior at one moment, and after that phase, they will not pass smoothly to a normal state, but will go to the opposite extreme, looking utterly exhausted, to the verge of collapse and cold all over. No reaction can be elicited from them. They seem to feel nothing and register no sensations. Even the sense of touch may be lost, and the skin is cold and insensitive, like marble. So you see, even in emotional area, they have this polarity, double polarity. So if you look at it, the principal keynote of camphor lies in this polarity. Very, very few remedies in our Materia Medica have this double polarity. जो है वो नहीं है और जो नहीं है वो वही है. So this is a saying in Hindi, okay, that what appears is not the truth, and what is the truth doesn't appear as the truth. So camphor is a little bit like that. So now I am taking one more pot shot at describing the characteristics of camphor. This is from the experts, this is from the spectrum of homeopathy. Number two, 2010 power drugs. This is Spectrum of Homeopathy is a magazine published by Narayana Verlag, a German magazine, German-based magazine, and they have beautiful illustrations and understandings of remedies of various kinds. So I have a bunch of those books with me. Again, they cost a lot, but they are worth their weight in gold. So what do they say? In a particular case that is described in that book, a lady talks about this. I'm sorry, I forgot her name. I'll put it down later on in the description. But what actually, give me a minute. Let me just check it out. Yeah. Yeah. Good. Anyway, this is that book, and to give credit while it is due. That's why I wanted to check it out. What this lady actually talks about. This is about camphor. And now the lady in question is Dr. Anne Shade. Okay. And this article is from page 114. It basically reads, "In the kingdom of the Snow Queen." Okay. It is how she comes via the detour of anhelonium, the sensation of constriction and dissolution of boundaries, then leading up to the sensation of icy coldness, which leads to camphor. So now this is a very beautiful case, and I'm taken it from this case, her summary of this case. Okay. So now, what does it say? It says the characteristics of camphor. The central feature is the extreme cold, which causes the life energy to retreat from the periphery to the center of the body. That is why it was used in the past for collapse and coldness with sudden and complete exhaustion of the life force. The feeling of an icy wind stroking the body. The remedy proving mentions tetanic spasms, inner heat and outer coldness. The cold of camphor is similar to that of veratrum. John Henry Clark described the state of reduced attentiveness in himself. Simple camphor pills are very effective for sleeplessness. What does Calvin B. Kner say? He says, lonely, alienated, and alone, left out standing in the cold. This is the symptom which is put in the Kner's repertory as is. John Henry Allen wrote of camphor, the outside world no longer exists for me. I was alone in the big universe, the last person existing. I was the final and single fragment of the entire creation. The only feeling in my soul was eternal hopeless damnation, great fear of being taken up. Now, this is an interesting polarity between great heat and sweat versus extreme cold and contraction. There is also much sleeplessness due to nervousness. You see, both of them are there, as I said. Finally, to finish off this particular video, an understanding of camphor from one of my other mentors, Dr. Rajan Shankaran. He has classified camphor as belonging to the Magnoliae family with the sensation of befuddlement, complete bewilderment, and confusion as a reaction to the outside world. The reaction to this sensation is to retreat into one's own world to which no one else has the access. Symptom of camphor is confusion when looking through a window, seeing everything on the street agitated and out of control. See, this is a beautiful symptom in the Kner's repertory. They have their own inner world where things are clear, but the outside world confuses them, as in this camphor symptom. Imagines being in a new world, so there is no inner orientation. They compensate for this weakness of the self by adapting to the world in a way that no longer corresponds to their own inner identity. So there is a conflict between their inner world and the outside world. The inner world, to use the Jungian phrase, has certain archetypes which are not actualized in the external world. Now, when you have a certain situation wherein the inner world, the archetypes of your inner world, they are not actualized in the external world, then you will see certain psychological disturbances. That is why camphor is a good remedy even for psychological disturbances. Let me just show you, go back, I'll pause this video. Okay, now going back, and I will share uh, this particular sharing this particular complete dynamics. I wanted to show you how beautifully we could have approached this particular case with the primary delusion of camphor, okay, which is a very important delusion, okay. So camphora officinalis, I select it, and I look for, in the particular case, delusion. And you see, towards the end, you will notice this particular symptom. Look at this symptom. Delusions, imaginations world. She has her own little in which things are clear, which is certain. So one could have actually come to this remedy, camphor, if I had probed into her own inner world. I could have come into this remedy instead of this circuitous route of the remedy, looking at the segments. If there is a higher delusion in a certain case, in her case, after some inquiry, I actually found out that she had this delusion. You can actually come to that remedy directly. So with that, I wrap up this video. Hopefully you learned a lot about camphor in this rather short video, even though this is a little longer video even for me. Please subscribe the bell icon and subscribe to my videos. Also press the like button to like it. Thank you very much and have a very good day.